আপনাদের মাইক্রোফোন এবং ভিডিও অফ রাখার জন্য। এবার আমি বেস অফিস থেকে সঞ্চারী বেগম মহাশয়াকে অনুরোধ করব আজকের অনুষ্ঠানের প্রধান বক্তা ডক্টর সামারুল ইসলাম সম্পর্কে কিছু বলতে। থ্যাংক ইউ।
Assalamu alaikum and good evening everyone. Now I want to introduce Dr. Samarul Islam. Dr. Samar is a demographer in population studies by training with an interest in population health, public health. He obtained his PhD degree in 2021 in population studies from the International Institute for Population Science, IPES, Mumbai. Mr. Samar holds his MPhil and master degree in population studies from the same institute. He graduated from the Aligarh Muslim University, Department of Geography. His current responsibility as a Post-Doctoral Fellow is to analyze the data on demographic and health issues, particularly social, economic, and epidemiological aspects of chronic disease among the elderly population. He has a passion for the research on environmental health, elderly health, and mental health. He has a rich experience in research spanning over 7 years in areas of population studies and public health. During his master and PhD, he underwent training in both qualitative and quantitative tools, which gave him a unique opportunity to analyze the research questions from the interdisciplinary and regional perspectives in tandem. His research also published in highly reputed journals like Indoor Air and Stoten. He received Best Paper Award at 16th IASSH conference in 2018 held at JNU, New Delhi. He has received a number of fellowship and travel grants throughout his academic career from various national and international organizations. He also visited number of countries including Norway, Germany, Netherlands, and Indonesia for academic purposes. He is associated with various national and international research bodies like International Union for the Scientific Study of Population IUSSP, France, Asian Population Association APA, Thailand, Indian Association for Social Science and Health IASSH, India. Thank you. Now I want to welcome Dr. Samarul Islam to his present lecture.
Thank you so much for this nice introduction. Base for giving me this opportunity to talk and share my thoughts regarding this subject, population studies, gerontology, and public health in India. Am I audible to everyone? Hello?
Yes, sir. Yes, sir. You are perfect.
Yes. So first off, this is the outline of today's presentation. Today I will talk about 3 subjects, that is demography and population studies. Then I will talk about gerontology, then public health. So my basic outline of these subjects is that I will discuss first about science, social science, major discipline, then followed by introduction, subject matter, interdisciplinary nature of the subjects, eligibility criteria for studying the subjects, and where to study, and what is the scope for higher education and research in India as well as in foreign countries, and what are the job opportunities. Lastly, I will talk about little bit about IPES. So first, when we study any subjects, that's subjects or a science is divided into 3 main parts. That is formal science, natural science, and social science. In formal science, we talk about mathematics and statistics, whereas in natural science, we talk about physics, chemistry, biology, and then social science, we have 4 or 5 major disciplines, that is economics, human geography, political science, sociology, and psychology. So here I mark the color in blue, that is mathematics, statistics, and biology, medicine. I will discuss about these subjects today in my in my topic. So I mark these subjects in blue color so that we can have a understanding. So the social science is the branch of science devoted to the study of societies and relationship among individuals within those societies. So in social science, there are 6 major subjects we studied, and all other disciplines in social science are more or less or directly or indirectly linked with these 6 subjects. That is economics, anthropology, sociology, geography, political science, psychology, and history. And there are also interdisciplinary social science like development studies, gender studies, international studies, public health, population studies, management, archaeology. All these other interdisciplinary subjects are linked with these 5 or 6 major social science subjects. So now let's talk about population studies. So basically, what is population studies? It is the scientific study of the human population. So in population studies, we study actually what are the factors behind their change in population. So the population change here we refers to due to birth, death, and migration of people. And what is the consequences of this population change or impact on the society? So the field of population studies embraces questions like why these changes occur, why birth is happening in a particular place, so many births, and why there is any particular there is number of days, why people are migrating, and because of this their dynamics or change, what is the societal implication, what is the impact of society. So this all about population studies. So we study in population studies 2 main factor, why the change is happening and what is the consequences of this change. So the population studies and demography, two distinct terms. So the both are interchangeably used, but there is a basic difference between demography and population studies. So in demography, we study mathematical or quantitative form of birth, death, and migration. Only quantitative. We measure the changes in population. While studies, we discuss the cause. In our social science, in demography and population study, we use the term interchangeably. Demography size and age structure, while the population studies involve the association with their characteristics such as location, marriage, status, education, unemployment, health, etc. So population studies is being a multidisciplinary, try to answer demographic events like birth, death, marriage, migration from an interdisciplinary perspective. So what are the subject matter of population studies? What are the subjects we study in population studies? So population studies is a vast discipline. It's a multidisciplinary and a multifaceted subjects. So in population study, we study about fertility and nuptiality. Nuptiality in scientific terms, in layman language is called marriage. Then we also study mortality, morbidity like epidemiology, then public health. We also study the divorce, family demography, divorce, widow, marriage. Then we also life table, then digital demography, political demography. So here is one example of political demography we can give is that the population day by day is increasing in northern part of India, but while the population is decreasing in southern part of India. So if we want to represent our MP or MLA in our MP in our parliament, so after 30 years, what will be the distribution of our MLA? So that study is concerned with political demography. So you also study historical demography, like currently we are facing a great crisis in terms of public health. We are facing coronavirus for 1.5 years. In earlier also, we faced this coronavirus, pelugu, then typhoid, chikungunya, and kalajor also. So this historical demography is linked with population studies. Then we also religious demography, why the Muslim various political leaders they say they speak about that the fertility rate among the Muslim is very high. So we discuss about our religious demography. Then we also talk about population projection. So today India is about 1.3 billion population. So what will be happen after 50 years? In 2050, what will be the total number of population? So we also project population projection. We also discuss about spatial demography. So what is the distribution of populations? Like in Mumbai city, there are more population than the country of Australia, but Australia is much bigger than India. So here we also concerned about spatial demography. We also use demography and statistical software. We also study this migration and urbanization, migration from rural area to urban area, and what is the pull factor and push factor. We also discuss about population development, then environment, and there are also a lot of other subjects like health, economics, population aging, biostatistics, epidemiology, and large scale surveys. Or also we also apply demography in terms of business, in terms of planning. We discuss about all these things we study in population studies. So it's a quite, you can see here, it's a quite large and big area we cover in our population studies subject. So now what I want to discuss, the population studies is not a major social science discipline. The major social science disciplines are geography, sociology, economics, psychology, anthropology, political science. But what is the relationship with population studies and other social science discipline? So geography, for example, in geography, the population studies linked with population geography, health geography, urban geography, then settlement geography, social geography, medical geography. Similarly, in sociology, we also study sociology of health, then we also study sociology of gender, then also we study environmental sociology. Similarly, in economics, we also studied a paper in development economics or welfare economics or health economics. Like our Nobel Prize winner economist Amartya Sen is work on welfare economics. And then in psychology we also discuss about health psychology, occupational health psychology, social psychology. In anthropology, the subject is related with social anthropology, medical anthropology. In law, immigration law. Then how is discipline with other discipline in science? Mathematics, we study the mathematical demography. Statistics, we also study biostatistics, health, social statistics. In medicine, we also study the community and social medicine. In population health, we also talk about maternal and child health. In reproductive health, the morbidity, mortality, and epidemiology health. So we can see here the discipline of population studies is linked with science, faculty of social science, and faculty of medicine also. So what are the other subjects other than this parent discipline is linked with population studies? So population studies is closely linked with this public health, development studies, and then remote sensing, health economics, aging study of gerontology, which I will talk about later, and mental health also, then public policy, migration studies. So the blue color, which shows that these are the disciplines which are closely linked with population studies. And the discipline which is I highlighted in green color, these are the emerging areas where the population is linked or they are overlapping with each other. So one example is that the computational social science. So computational science is talk about the use of computer and its artificial intelligence, data science, and computer modeling for the study of demography, for the study of social science, for the study of human behaviors, and these are all overlapping with each other. So the discipline of population studies is linked with also a number of discipline at the postgraduate level. So what is the eligibility? The next is what is the eligibility criteria to study population studies? So the population studies basically offered at the postgraduate level. One or two university offer population studies at the graduate level, undergraduate level. So the basic criteria of population studies is that having a master or bachelor degree in mathematics and any social science subjects with 55% aggregate marks from a recognized university. So why to study this population studies? So population studies, this International Institute for Population Sciences offer courses. Then Jawaharlal Nehru University, then University of Kerala, Institute for Social and Economic Change. I highlighted here some of the major universities in India which offered population studies as a master degree as well as PhD degree. So the highlighted institutes are more popular and considered as a good university in terms of doing research in population studies. So what is the, now I will talk about the focus of higher education and research. So after a person graduate in population studies, what is the higher scope of doing research? For example, a student who is a master degree in geography and he or she want to pursue his PhD degree in population studies can research in their parent discipline, like in geography of health, in population geography, in development geography. Similarly, a student with economics background can carry out research in the field of health economics, health policy, then development economics. Accordingly, a student of sociology background can pursue their research on associated subdisciplines such as sociology of health, sociology of family and marriage, and etc. So you can enroll in PhD degree as a population studies student. Still, you can carry out your research from your parent discipline or parent background or master degree background, and you can carry out research in population studies. So this is the real beauty of studying population studies. So a student who can do this her research like a PhD and a research degree. So population studies, being a multidisciplinary subject, can pursue his or her higher education in almost all 29 institutes of Indian Council of Social Science Research. In India, we know there are so many social science research. Like in West Bengal, there is an Institute of Development Studies. Then there is an Institute of CSSS. We can enroll there and carry out our studies in population studies and related discipline. So there are some major state and central universities which offer a degree also related or areas related to population studies degree, like University of Hyderabad, University of Kerala, the Jawaharlal University. Among the IITs, the IIT in Humanities and Social Science Department, you can carry out this study of population studies and related subjects in like IIT Kharagpur, Bombay, Madras, Guwahati, IIT Roorkee, IIT Mandi, IIT Gandhinagar is very famous for those students already have a degree in population studies, and they can enroll there and carry out their further research in PhD. Similarly, in IIM, Indian Institute of Management, we also can enroll enroll there as a PhD fellow and carry out our research. Like in IIM Bangalore, they have a Center for Public Policy where the faculty members they do research on public policy and health policy. So in Kolkata also, IIM Kolkata, a student can their research in regional development. In IIM Ahmedabad, there is Center for Health Management. You can carry out a research related to health management and health policy, health finance. So in AIMS, Delhi and Jodhpur, they offer master degree in related to Master of Public Health. We also carry out our research in National Institute of Technology, like National Institute of Technology, Rourkela, National Institute of Technology in Warangal, and there are some other NITs also offer this population studies related course. So one more very premier institute of India is Indira Gandhi Institute of Development Studies. So here the institute offer degree in development economics or development studies. So a student have background in population studies can go and enroll there for their PhD degree. So similarly, Tata Institute of Social Science also offer a number of courses related to population studies for higher education. So what are the opportunities of these subjects at abroad level? So basically, this population studies is related with the Department of Sociology in all major universities in across US and UK. All major universities, almost all universities in US and UK offered courses related to population studies and demography. So basically, I highlighted here some of the premier institutes in this discipline for carrying out higher education, like Max Planck Institute for Demographic Research in Germany, which is a very famous institute, and then London School of Hygiene and Tropical Medicine, then this institute, International Institute for Applied System Analysis in Austria, then also there is an institute in INAD in France, then Netherlands, NEDI in Netherlands, and also we can have these courses in Harvard University, University of Maryland, in National University of Singapore, Asian Demographic Research Institute in China. Also, there are a lot of courses they offered on population studies and demography. So what are the job opportunities? Now we'll talk about job opportunities in this course. As we discussed that the discipline of population studies is linked with a number of disciplines, both social science, science, medicine, and also other interdisciplinary subjects like development studies, public policy. So student in discipline trained as a multidisciplinary researcher. Graduates in this field can work in both international as well as national and private organization, non-government organization. So the main opportunity in this population studies is teaching and research. This is the major area where the most of the graduates actually they work. Then other areas like Census of India, then we can work a number of ministry like Ministry of Health and Family Welfare, Ministry of Women and Child Development, Indian Council of Medical Research, then Indian Council of Social Science Research. Then also we can also work in Niti Aayog. Then we also work National Health Authority. Apart from this national level, we can also work at Nation Population Fund, United Nations Children's Fund, Pop Council, World Bank, Asian Development, Bill and Melinda Gates, World Resource Institutes. A major and important organization where a graduate in population studies can work and then carry out the research. So what are the major association or society in this? Of population studies and related areas. So as I discussed that the discipline of population studies exclusively offered at International Institute for Population Sciences in Mumbai. So this is the only institute in India under the Ministry of Health and Family Welfare that exclusively and solely devoted for the study of population studies. So I want to talk about a little more about this IIPS so that the audience can get some idea regarding this population studies. So this population studies actually established by the government of India, United Nations, and Sir Dorabji Tata Trust in 1956 as a demographic training and research center. And this IIPS is a deemed university and autonomous organization under Ministry of Health and Family Welfare in India. And there are some of the unique characteristics of IIPS I want to talk about. Here is that the IIPS is the only institute in India that carry out all major large-scale demographic health survey like NFHS, LASI, DLHS, SAGE, GATS. Till 2019 and 20, 346 students completed their PhD and 678 students from different countries like abroad and the neighboring countries like Bangladesh, China, Nepal, and Southeast Asian countries. Students from those countries completed their degree in IIPS. So in total IIPS there are 30 faculty members and I have students of less than 300. So we are basically as a school Actually a school that 300 students and 30 faculty members. And but one thing is that we are very good. Our campus is very small, but our campus has a very rich library and competent data science. So students from all over India come and study in IPS. We celebrate all the festivals and festivals. And the interesting part in about IPS is that we run hostel, and students run the hostel mess. Actually, it's a non-profit. So we are very is like a family. We call is the IPS family. And in our institute produce some of the world-renowned demographer or population scientist like Professor K. Srinivas, Professor P.N. Maribhat, Professor T.K. Roy, Professor Ephraim, and Professor K. James, Professor R.B. Bhagat. These are the some of the faculty members from our institutes are known worldwide for their scientific study in population studies. So what are the courses offered in population studies? So basically we offered here 6 courses. One is Master of Arts and Science in Population Studies. The second is a Master Degree in Biostatistics and Demography. And third is Master of Population Studies. So I will talk about this Master of Population Studies in my next slide. Then PhD degree, both part-time, full-time, also Post-Doctoral Fellowship. So I will talk about what is the unique characteristic of IPES. I can say the IPES is the only institute in India apart from IIT Gandhinagar that offered 5,000 scholarship per month for all the enrolled students to pursue their master degree. So if you enrolled in master degree in any course, you will get a scholarship 5,000 per month. So, and the second unique characteristics for IPES is that MPS degree. It's a 1-year master degree. So in nowhere in India that there is a degree of 1 year. Actually, master degree is about 2 years, but in IPS the MPS degree is about 1 year, and it's a UGC recognized degree. You can have same value with other master degree. So what is the eligibility criteria of pursuing MPS degree? For the basic criteria for MPS degree is that the candidates must have a postgraduate degree in science subject or social science subjects. So science subject means here this biostatistics, statistics, and mathematics. And social science means economics, geography, then political science, then psychology, sociology, and social work also. This, if you do not have the degree in these subjects, then still you can enroll, but you need 2 years of experience in population and health related field. And one more interesting thing is that the fees in IPS is very nominal. So one candidate can pursue her MPS degree with a 20,000 fees in a year. So another candidate can pursue her master degree with just 30,000 per year for master degree. So it's a very nominal. And interesting thing that IPS also and Government of India Ministry of Health is providing you 5,000 scholarship per month. So next is PhD as then one more important unique characteristic of IPS that we all know that if you qualify GRF in any discipline like geography or economics, you can enroll and can get scholarship. But in IPS case, even you do not have GRF, but you have NET, then you get the same amount of scholarship in IPS for pursuing PhD. This is also unique characteristics of IPS, and you will get the scholarship equivalent to GRF and equivalent duration also. So the eligibility criteria of IPS for PhD is having a master degree in population studies, biostatistics, demography, and the upper age limit is 30 years. And what is the selection procedure? This entrance exam, presentation of your research proposal, as well as personal interview. So one more interesting here is those students pursue PhD in IPS, they get also scholarship for attending conference and workshop abroad. So in IPS we get a lot of exposure. In IPS, if you are pursuing your research in a very good way, or you are a good student and you are focused on your research, then you definitely will get a chance to visit and abroad for attending a workshop or conference. So in IPS, generally a student who complete his PhD is 2 or 3 country visit at least. So even myself, I visited almost 10-12 countries, more than 10-12 countries for my PhD degree. So the next is post-doctoral fellowship. IPS also offered post-doctoral fellowship, and the eligibility criteria is PhD degree in population studies or related areas like health, gender, development, and other social sciences. So the duration is 1 year, and you will get a fellowship of 50,000 and HRA per month. Around 12,000 HRA you will get for pursuing his post-doctoral fellowship. And it's a very interesting and nice thing that if you are looking having a degree in geography, having a degree, or you have done your PhD in economics or geography or any other social science discipline, and you want to have experience in population studies or public health area, then IPS will be the best choice for you to pursue this post-doctoral fellowship degree. Now I talk about this gerontology or population studies. So what is this population aging or gerontology? What I means here, then when we are talk about this population studies, I am starting regarding all age group, irrespective of whether it's child or male, female, or adult or elderly population. I am starting everyone as a population studies student. But what is the basic difference between population studies or gerontology is that I will study only about those population age 60 and above. I will not study below that. So what is the population is refers to the increasing median age in a population or because of decline in fertility and rising life expectancy. So what I mean to say is that median age means average age. So like in our country, the average age of population is around in 20s. But in Japan or in other developing countries, the median age or the average of the population is above 35 years. So they are aging actually, they are growing old. So the subject of gerontology is study the social, cultural, psychological, cognitive, and biological aspects of aging. This is this gerontology from the social science perspective. So if we want to study this subjects from medicine perspective, then it will call it geriatric. So what is geriatric? Geriatric is the relating to old people, especially with regard to their healthcare or focus on healthcare of the elderly people. So when we elderly people in our home get ill or have some kind of infection, then we visit hospital and we treat with a geriatric physician, not a normal doctor, but they are specialized in geriatric or elderly health. So this perspective from medicine background, so we can see here that the discipline of gerontology is from social aspects, social science background, and medicine background. So this map actually about regarding the across the country and what is their average age, median age. So in this map we can see here the country like in this Canada, then almost all the European countries, and then Japan having a very high level of median age, that is average age, while as the African countries has the low level of median age. This reflects that the population of Africa is still young as compared to developed countries like America and European countries. So so what is the percentage of population? Total population is number of people age 60 years and above. So we can see the first map, world map, is shows that the country of developed country like European, Russia, and then American country, the percent of total population 60 plus age group is very high. Whereas in African countries or in South Asian countries, the percentage share of 60 plus population is still quite low as compared to them. But in Indian case, the share of 60 age population is not same across states in India. So in India also there is a great disparity in share of 60 age plus population. Like in Kerala, Tamil Nadu, then Punjab, Himachal Pradesh, the share of 60 age population is higher than central or Hindi belt of India. So Rajasthan, Madhya Pradesh, Uttar Pradesh has the share of 60 age plus population is still low than the state of Kerala. So this shows the how this disparity in elderly population across in India. So now, why should we study this subject actually? Why should we study population studying or gerontology? As we know that if a person is born, then he will definitely will die. So if you see across the world, the first graph shows that the population age under 5 years of age is declined. The red color, the age from 1950 to 2050, their share is slowly decreasing, but the population age 65 is increasing. So eventually there will be more 65 population in 2050 than under 5 years of age. Similarly, in India also, since 2050 to 2100 century, that the percentage share of 65 plus population is increasing day by day, while this all other population group like working age population 25 to 64, and then adolescent and children is declining day by day. So we will have a more number of elderly population at a 2050 than any other period. So that's why we want to study this population gerontology or population aging. So what is the subject matter in population aging or gerontology? So this, as we say, I earlier told that the subject of gerontology is also multidisciplinary. They have four major category. One category is biogerontology. So the biogerontology is concerned about biological aging. The students who have background in biology, they are more likely to study biogerontology, and it's about preventing age-related disease by intervening in aging process or even eliminate aging. While the students from social science background, those are from geography, economy, sociology, they study social gerontology. So they want to study regarding old age, regarding everything, where they're living, who are their friend circle, what is their pension, what is their work, retirement life, what is their disease, and what kind of problem they are facing in their old age. So everything we are studying in social gerontology. And then we also study environmental gerontology. So environmental gerontology, actually, when a person getting old, his immunity system or biological process is it gets slowed, and they are not much more effective than a young or adult population. So his or her physical or in social environment affecting his health. So this subdiscipline is related with environment and health among the elderly population. Then also we have jurisprudential gerontology. So it's actually from law background and legal structure. Actually, if in our society we know that many we read in newspaper, we also heard in news that there is elderly abuse, or पेरेंट्स को खाना नहीं दे रहे और पेरेंट्स को घर से निकाल दिया. तो ये जो चीज है, मतलब ये जो इश्यूज है, दैट्स वी विल स्टडी from the legal perspective, what the government also have provision for the elderly population. So this subdiscipline is talked about from law background. So, and then as I said that how this gerontology is linked with medicine. So as elderly population is getting old and they are having more and more health problems, so the medical doctor, MBBS doctor, when they pursue their postgraduate degree like in MD, they specialize in geriatric medical healthcare. So geriatric healthcare is have so many sub-discipline like geriatric psychology and loneliness and depression and then dementia also. Then we talk about geriatric public health and then geriatric rehabilitation, geriatric nutrition. So the elderly population, because of their high blood pressure, because of their diabetic, they are more choosy in their food habits. They need to avoid salt. They need to avoid this sugar, and they also there are many things that they have to change. So it's talk about geriatric nutrition. So because of their health problem, or they're also specialized nursing, that physiotherapy. So this all about there are some sub-disciplines that talk from medicine background or medicine perspective in gerontological studies. So this how this gerontology actually linked with other discipline. What is the interdisciplinary nature of gerontology? So a gerontologist may have degree or training in social work or in nursing, in psychology, then sociology, also in population studies, public health, and then epidemiology, public policy, and food and nutrition. So it's not necessary the student who is pursuing course in gerontology will work on gerontology. So the students from other discipline also can work on this area as having a background, and they contribute in their own perspective and on their own discipline in actually in the broader domain of gerontology. So what is the criteria to study gerontology? Basically, gerontology is also not offered at bachelor degree, and it's offered mainly as a master degree. So students background in same as population studies criteria, the same criteria is also apply for gerontology. So where to study this gerontology? So basically in India, there is no university in India that offered degree course in gerontology actually. So there are some of the institutes offered gerontology as a PG diploma or certificate. So among them, the prominent institute in India is Tata Institute of Soil Science. It's offered PG diploma, and then Calcutta Metropolitan Institute of Gerontology in Kolkata, that is offered. They offered this PG diploma and certificate also. Then University of Delhi Institute of Home Science, they offered PG diploma. Then National Institute of Social Defense, they also have diploma. There's only one university in India, that is Sri Venkatesh University, offered master degree in gerontology actually, and the University of the Banaras Hindu University offered PhD degree in biology of aging. Those students have a background in biology, they have a course on biology of aging, they can pursue PhD there. So apart from this soil science background, when a candidate from health background like MBBS or background in nursing or allied health discipline like physiotherapy, pharmacy, nursing, or they can pursue this MD or diploma degree in geriatrics. So again, I repeat here that geriatrics is a medicine from medicine perspective, but in soil science perspective, we are calling it as a gerontology or population aging. So these are some of the premier institutes of India that you can enroll for MD degree in geriatrics, like All Indian Institute of Medical Sciences Delhi, then Christian Medical College, then also this MGM Medical College in Maharashtra, then King George Medical College in Lucknow also, and there are also some of the courses for the allied health discipline like PMD in geriatrics, then physiotherapy in geriatrics. So Manipal University in Karnataka, they offered MP degree in geriatrics actually. Then Meenakshi College of Physiotherapy in Chennai, they offered degree in physiotherapy, and this Suman Deep College of Physiotherapy in Gujarat also, they have offered degree on physiotherapy actually. So is there any opportunity for this course in abroad countries? So again, the similar to popular studies, there are a lot of opportunity in discipline, because we know that if somebody is born, then he will definitely will grow old and he will have problem related to his old age. So there are some of the premium institutes which offered research and as well as degree on gerontology is National Institute of Aging in USA, University of Southampton, John Hopkins University, then University of Connecticut in USA, and King's College London, and any other institutes in USA. So basically, developed countries, they have a more issue of population is aging, and they also have more courses related to population aging at old age. So you can search internet and can look after which university you want to pursue your courses. But more or less, almost more than 60% university in developed countries, they have this course of gerontology. One of the very good university for this course is University of Southampton. This university also offered master degree both in regular mode as well as in distance mode. So you can enroll there for a distance education if you want to interested to study and pursue your PhD degree in Indian Statistical Institute in Psychology and Sociology department. So Institute of Kolkata, Indian Statistical Institute Kolkata, they also have offered degree in within the discipline of psychology and sociology in population aging. So what is the job opportunity in this discipline? Is Ministry of Health and Empowerment. They have degree. You can have job opportunity there. Then there are some of the NGOs like HelpAge India, then International Longevity Center at Pune, and Center for Gerontology Studies at Trivandrum also. So you need to understand here is that the population studies and gerontology is very closely linked. I am separating this discipline on the basis of age group. So if a student is having a degree in gerontology, can also work on the similar discipline which I talked about earlier, my slides, that can work all those areas. So I am not repeating here, but I am here mentioning a few of the exclusively areas where you can and get the job in after pursuing your gerontology courses. So these are some of the institutes like Gerontological Society of America, then International Association of Gerontology and Geriatrics, Indian Gerontological Society, and Indian Association of Geriatrics. So these are the society that promote and do research on gerontology. And in India also, this Indian Gerontological Society is based on Banaras Hindu University. They carry out a lot of research on gerontological studies. So I will take just 30-second break here. Then I will talk about public health just for water drink. So please allow me to take a break of 30 seconds or 1 minute maximum, so that I will carry out the next my next topic, that is public health.
Okay, sir, you can, no problem.
Hello, am I audible?
Yes, sir, you are audible.
Shall we start again?
Yeah, sure.
Yeah. So now the next discipline I will talk about this public health. So one thing is that why I am choose this three discipline and I'm talking together because these three disciplines are closely related with each other. You can't separate with these three discipline alone or exclusively discipline. So I also at the last of my presentation I will talk about how these three disciplines are also linked and how these three disciplines link with my career also. So what is the public health actually? The public health discipline is defined with the science and art of preventing disease or prolonging the life and improving the quality of life through organized efforts and informed choice of society, organization, community, and individuals. So the public health is not actually the medicine actually. Those candidates or students pursuing degree in medicine, they are treating a particular disease with medicine, but this public health discipline is not about you are treating a particular disease, but with your change in your behavior, with the help of society, with the help of government of India, with other communities, your neighborhood, you are actually you're actually improving the lives of the population in general. So in public health we also discuss about also known public health also known about is like a global health or international health. So actually public health is related with global health, which is the health of the population in the worldwide context. It has been defined as the area of the study, research, practice that places a priority on improving health and achieving equity in health for all the people worldwide. So it's when we are talking about improving the health for worldwide, for all the population in this earth, then we are talking about global health. But when we are talking about a particular region or national boundaries, then we are talking about international health. So the discipline of public health also offered courses. Various universities, they have also offered courses in global health, in international health, as well as in public health. So next slide I will discuss how this they actually this all three terms actually interchangeably we use in the discipline of public health as a broader area. So in public health, what we study in public health? So similarly to population studies, the public health discipline also is multidisciplinary. It's draw its subject matter from a number of discipline or sub-discipline. So public health, as a student of public health, we study as an epidemiology, as a morbidity on our disease. Then we also study biostatistics, that is part of statistics. Then population studies, health economics. We also study health management, how this health management affect this public health. And then we also talk about public policy, then also environmental health. So one here is example of environmental health can talk about this, like this coronavirus. We are facing coronavirus. So recently WHO, just a few months back, there's a speculation that the virus is also airborne. Its airborne means it refers to that virus can also transform through air. So here is the concept come of environmental health. Then also community health. Then we also can talk about behavioral health. Health in public health, we also talk about mental health, occupational health, elderly health. So there are many disciplines that linked with public health in a way or other. But what are the core areas that a public health student learn or study? That is I highlighted here the core discipline in blue color, that is epidemiology, biostatistics, environmental health, health system, and policy and social and behavioral science. So we can with the graph we can see here the how this public health is linked with a number of areas. So we have a coronavirus disease right now. So we are promoting health promotion. So in terms of advising people, please wear the masks, please sanitize your hand. So we are also surveilling what is the number of cases every day in India and which states have number of cases. So we are surveilling as well as monitoring. We are also analyzing data. We are analyzing data कि कौन से एज ग्रुप का population जो है कोरोना वायरस की वजह से ज़्यादा डेथ हो रहे. So we are also analyzing outbreaks. So we are also analyzing, or we also try to analyze what are the hot spots of coronavirus. So like in Mumbai is 2 months back is the hot spot of coronavirus, and then Bangalore, then Ahmedabad, Bhopal, Delhi. These are the hot spots of coronavirus. So there are many things we are doing with this public health discipline actually. So public health discipline is not like a single discipline, but it's related with multidisciplinary and interdisciplinary in nature with multifaceted background. So again, how this public health is related with major social science. So as I said earlier, that the discipline of geography, we study a student who studied a master degree in geography, he or she must be studied also this health geography, then environmental geography, then remote sensing and GIS. So with the help of remote sensing and GIS, we try to locate or map through visualization that what are the areas of outbreak in coronavirus. So other diseases like also in sociology, this sociology of health, then environmental sociology, economics discipline is linked with health economics, and then also demography or population economics. In psychology, we also talk about social psychology, how this social psychology is linked with public health, then clinical psychology, then health psychology, then occupational health psychology. So the discipline of psychology, sociology, and anthropology is closely linked with the discipline of public health in health in social science. So the discipline of public health also linked with science faculty and medicine faculty. In science faculty, basically the public health is linked with biostatistics, health statistics, and population statistics. And then in again the discipline of medicine, as we talk about this, a doctor, a medical doctor, after his graduate degree in MBBS graduate degree, he or she want to pursue a master degree like MD. So when a candidate with MBBS degree go with postgraduate degree like MD, he want to pursue specialize. So there are options like you want to specialize in heart disease, you want to specialize in ENT, and you want to specialize like pediatric, you want to specialize in medicine, you want to specialize in surgery. So there is also another discipline in medicine that talk about public health. It's called is social and community medicine. You might be heard somebody or your fellow that is doing MD degree in social and community medicine. That social and community medicine nothing but actually public health. So how this public health is interdisciplinary. As I discussed earlier slide, the public health discipline is also linked with epidemiology, social epidemiology, population studies, health management, health economics, and then microbiologist, statistics, and data science also. We use new model and machine learning to predict the prevalence of hypertension, the prevalence of diabetes in a population, the prevalence of HIV prevalence in India, or AIDS disease. So these are the major areas which closely or linked with the discipline of public health in India. So So what is the eligibility criteria to pursue this degree? So one has to have a degree in statistics and biostatistics, and of course in from social science also. In science background, biology and related discipline like physiology, microbiology, botany, chemistry, zoology. But this biology discipline is more or less, they are concerned about biology of aging. They are not concerned, they are little or less loosely concerned with social aspect of public health. So public health, so MBBS and allied discipline also, they also pursue this public health degree, and it's very popular among the MBBS graduates. They want to have a degree in public health. So what are the courses offered in public health actually? So there are some of the courses offered with different name, but the syllabus more or less is closely linked. That is Master of Public Health, and then Master of Science in Public Health, Master of Medical Science in Public Health, and Master of Health Science also. And this, I talk about this MD degree in Community and Social Medicine also. So this is also another form of a public health degree, a degree in different states and different country. So where in India offered this public health degree, actually the discipline of public health in India is very new, though it is old, but is gained popularity in the last 10 years. And in 2016 and 17, only 44 institutes offered public health degree. Among the major institutes in India which offered public health degree is Indian Institute of Public Health, and this has many campuses like in Gandhinagar, Delhi, Hyderabad, Bhubaneswar, and Shillong also. So another university is IIHMR University. It has a campus in Jaipur, Bangalore, Delhi, and Kolkata also. And then Tata Institute of Social Science, Jawaharlal Nehru University, and then in West Bengal also there is 2 institutes that offer public health courses. Institute of Public Health Kollani, that is in West Bengal, and then All India Institute of Hygiene and Public Health, Kolkata. So then again, then PGI Chandigarh, then Sri Chitra Institute that in Kerala offer public health courses and public health degree. So the color which I marked in blue, actually these are publicly funded institute or government institutes. They have relatively less fees in fees. Though this Indian Institute of Public Health, it's actually private institutes. This IHMR also, they have more fees. So it's a bit costly to pursue degree in these institutes actually. So, and the blue color also is premier institutes in India. They have very well organized syllabus, and their faculty members also well experienced, have a very good department and research training. Some of the other institutes where public health offered, the Asian Institute of Public Health, then Christian Medical College in Bangalore, in Vellore, Tamil Nadu, AIIMS Delhi, AIIMS in Jodhpur, AIIMS in Rishikesh also offered public health courses. The National Institute of Epidemiology in Chennai, in Jamia Hamdard, then PGI Chandigarh and Nimans in Bangalore also offered these public health courses in India. So I want to what is the scope or higher education opportunities in public health? So actually between 1997 and 2016 and 2017, the number of institutes offering MPS courses increased from 2 to 44. So with this graph, we can see the private institute from 2007 to 2015, how these private institutes is with increasing number of private institutes offering MPS degree because of its popularity. I'm extremely sorry for this poor graph actually. I had borrowed this graph from article. That's why it looks a little dull. Though I have data from till 2016-17, but during the last 5 years, a number of institutes, it's now touched more than 70-80 institutes in India is offering public health courses or related to public health courses in India. I have not mentioned all the courses actually, but there are some institute which offer public health course and research. You can pursue your research there. So like IIPH Gandhinagar, it's a first public health university in India, major public health university in India. You can do your research in public health in IIPS and Tata Institute of Soil Science. Jawaharlal Nehru University, New Delhi also offered also course on public health. They also offered degree, both master degree and as well as PhD degree. Then Sri Chitra Institute in Kerala and Nimhans Institute. You can pursue research there. Then also in IGDR in Isaac Bangalore also you can pursue your research. In addition to these institutes, you can also pursue research in ICMR Institute. There are so many institutes in India ICMR funded. Like in Mumbai, there are two institutes with ICMR funded. So a student with a background from biology or medical science, they can enroll in ICMR funded institute, and they can enroll there for higher education in public health research. So what are the foreign opportunity in public health? So basically, in almost 95% university in UK and USA, Australia and Canada, they have a public health department or public health faculty. So USA is a leader in public health. USA is so advanced. European countries is so advanced, but still they are more concerned about health, and they have a degree, they have a faculty, they have a number of degree courses in public health. So these are some of the premier and world renowned institute that can have offered degree courses on public health. So one very interesting field is that one thing is that about public health, that when we will pursue a PhD degree, or you want to do your PhD in foreign countries, there are a number of scholarship. There are a number of scholarship, even this Bill and Melinda Gates, and there are a number of foundation, PAC Foundation, Human Foundation, and there are then US Agency for International Development, then UK Agency for International Development, then Commonwealth Fellowship, Fulbright Fellowship, Rhodes Scholarship. You can Wellcome Task Fellowship. So you can actually use a number of scholarship in this area to pursue your higher education in developed countries, and you can have a good opportunity there to explore more. And one advantage of this public health is that you are training as a multidisciplinary researcher. So if you do not get opportunity in a particular field, you will get opportunity in another sub-discipline. So this is the beauty of pursuing this public health discipline. So you will never get bored actually. So what are the job opportunities in this area? So similar to population studies, so those areas I mentioned, in addition to those areas, I also add some more areas here. So in addition to those areas I earlier slide mentioned that a population studies graduate can work, these are the addition in the organization where can you also work. So you can work also in Public Health Foundation of India, Ministry of Health and Family Welfare, then ICMR, and then National Health Authority, and then Center for Disease Control in India also. So as a public health researcher, what kind of job you will do? You will have a job as a faculty member. You will have a public health researcher. Then you can work as a epidemiologist. You can work as a biostatistics, environmental health researcher. Then you can do your as a researcher on health system. Like in India, the health infrastructure, like primary health care, the hospitals, district hospitals, you can work there. You can also work as a behavioral social scientist. So in India, the health system is quite poor as compared to developed countries or middle income countries. But so there are a lot of scope that you can get a good job after you pursuing public health research. The only and primary condition is that you need to be a good student. So there are opportunities in every discipline, but there are also competition. So you need to be a good student, and you can pursue this course as a good career opportunity. So these are some of the discipline and society that discuss with the discipline of public health, and they promote public health education and public health research in India. In India, the Public Health Foundation of India is a leader in public health research in India. So I had also mentioned to Wikipedia link where you can go and search what are the other public health institutes in India, and what are the public health agencies and association across the world in India. So every country has an association of public health. So I didn't mention here because it will be too much. So I didn't mention here. But you can search on Google and what are the public health association in India as well as in other countries. So now I finished this third discipline. So I will just take few more minutes, maybe 7 minutes to finish my talk. So now I discuss three disciplines, that is population studies, population aging or gerontology, and public health. So why a candidate should study these subjects? So first and foremost important part is that whatever we do in our life, there is two goals, that is well-being of the population and development. So these two things are closely related with these two disciplines, and India is the second largest populous country, and we will be the largest population country by 2025 or 2026, and by 2050 India's population will be 4.7 billion. So the elderly population, the share of elderly population will also increase from 90%, from 8.6% to 19% by 2050. The demographic events like fertility and mortality, fertility also reducing and mortality also reducing. So we are also, with the help of science and communication, we are with improvement in medical technology, we are also having increased life expectancy. Our life expectancy is increasing, so there will be more number of elderly population. So again, there is another important feature of population is migration. Nowadays people migrating more and more. So people migrating, even me, I am from Kolkata. I came to Maharashtra in Mumbai. I am pursuing my education here. So I am migrating from Kolkata to Mumbai. So there are many other, like people from Bengal, people from UP, Bihar, Madhya Pradesh. They are coming to Mumbai. They are coming to Delhi. They are coming to Kerala for opportunity. So this led to migration. So this will have an impact on the society, and this will also change in age structure of the population. It will have an implication, wide impact implication on economic terms, like there will be impact of business, economic opportunities. There will be, as we India have a more and more young people, so there will be more and more unemployment. There will be poor development indicators, like Kerala has a very good development indicators. Kerala has a very good health infrastructure as compared to Bihar. So this will create a regional disparity. It also will have an impact on political. So Kerala population is day by day is decreasing, whereas the population of Bihar is increasing day by day. But as we know that our parliament representation is limited. We have a fixed number of people for one MP. So when in 2050 or 2030, the Kerala population from 10 lakh to will reduce to 5 lakh, suppose in case, and the population of Bihar will increase from 10 lakh to 50 lakh. So their number of MP will be more. So they will say that we have greater authority in parliament than Kerala peoples. So this will create a new debate. So that's why we should study population studies. Again health status. So as people we are shifting from communicable disease to non-communicable disease. Like earlier there are people suffering from communicable disease like waterborne disease like malaria, typhoid, and then child related disease. There are more maternal mortality earlier, but nowadays those diseases are reducing, and non-communicable disease like diabetes, like hypertension, like cardiovascular disease, like heart disease. This is increasing. So this has a serious impact on the health of the population and their well-being. And interestingly, India is one of the country where Indian government is spend only 3.6% of GDP on health, whereas the country like USA, they spend 16%. 16% of their GDP they spend on health care. So there is a great disparity across the developed countries and developing countries in health expenditure. So even recently there is a report that the country of Bangladesh, they have more per capita income than India. So this will have a serious impact on the when the people will suffer from a number of diseases. This will have impact on their productivity, their life, their education outcome and of the children. So that this will create a number of interrelated problem in our society. Ultimately we will become more poor and poorer. So these are the some of the major facts that can motivate us to study these three disciplines of population studies, this gerontology and public health. So now we social students of social science as well as the higher educated graduate, we must be aware that the United Nations has have some fixed goal. There are seven major goal, and these goals they have set limit to by 2030 they will complete actually. So among these 17 major goals of sustainable development, there are goals like poverty, no hunger, then good health, quality of education, then gender, clean water and sanitation, the good jobs and economic growth. These out of this 17, almost 5 6 almost 7 8 are directly linked with the study of population studies, gerontology and public health, and other discipline directly or indirectly linked with population studies. So you can understand the importance of this discipline. These three discipline is linked with almost 8 to 9 target 8 to 9 goal of out of 17 goal. So this is the importance of this subject actually. So I want to give a practical example about me actually. I want to give my example on this thing, that how I evolve this discipline actually, how I came across this discipline. Actually, I have done my undergraduate degree in geography and sociology from Aligarh Muslim University. Then I come to IPES, and here I completed my master, MPhil and PhD in population studies. What is interesting is that I earned my degree in population studies. I earned my PhD degree in population studies, but actually in my PhD degree, I work on public health with sub-discipline of environmental health. In my PhD, actually, I worked on public health with focus on household air pollution and child health. And now in my PDF, now I am pursuing PDF, and I am working on gerontology. So a student from population studies background can work simultaneously all these three disciplines: gerontology, public health, and population studies. And earlier also we discussed how these three subjects is linked with other social science discipline, life science discipline, and medicine also. And in this discipline also how linked with other interdisciplinary subjects like public policy, development studies, social work. So you can understand the horizon of this horizon and the width and broad and scope of this discipline through my example. So when I did my PhD, I choose a topic to carry out my research on understanding the association between markers about household air pollution and child health in India. While doing this research, I have draw resources from multiple discipline. So I have draw resources from multiple discipline like nutrition, public health, then geography, sociology, economics, anthropology, psychology, statistics, and many other discipline. So when you are doing your research, public health research, or population studies research, then you will be trained as a multidisciplinary researcher, not as a only population studies who study fertility and mortality. A student of population studies not studying only fertility and mortality, but he is a multidisciplinary research and equally compete with discipline of other students like geography, sociology, economics, psychology, statistics, all other discipline. So this can help you to grow, to understand better, and to contribute more quality research for the welfare of the society and development of India as well as a whole actually. So this all about my talk. Thank you so much for your patience listening. I appreciate all of you for attending this lecture, and I must I kindly request to you, all of you, to give your comments if you have any doubts, questions. I must welcome all of you.
Thank you so much, sir, for this informative session. Now it's open for the all participants to ask the questions. You can write your questions or message or raise your hand. We will call out. Okay. So if you have any queries, you can ask your queries in a message box or raise your hand. We may take 3 or 4 questions from the audience. So please. So there are some questions in message box. You can read and give the answer, the questions. You can.
Could you please repeat the question?
Okay, so
Yes. So one question here I can see is how much. Oh, could you? Sorry.
How much opportunities for West Bengal College service after completions of research from IIPS, from Shaptoshi Kundu?
Yeah. So here, yeah. So yeah, thank you so much for this interesting question. Actually, if you have degree in parent social discipline like sociology, psychology, economic geography, then easily you have degree like master degree, not undergraduate degree. Then you want to pursue course in IIPS, your PhD. Then you want to go this College Service Commission in West Bengal. Then you will have a lot of opportunities. But you can become a faculty member in the discipline of economics, sociology, psychology in your parent discipline, but not in population studies, because in West Bengal there are no university or no college that offered population studies degrees in West Bengal. But in case if you pursue master degree as a public health, then there are 2-3 institute or university in West Bengal. There you can become a public health researcher. The second part, how much competition and unemployment rate in population studies. So the competition is everywhere. In every discipline that you have competition, but the only thing you need to be understand is that you need to be good student. If you are not good, then you will not able to compete with anybody. So, and the unemployment thing is that this discipline as is very vast. It's a multidisciplinary. So there are a lot of opportunities. So the jobs in government sector is little low or less, but there are a lot of opportunities in NGO sector or development sector. So a student who have degree in population studies, they do not actually they actually do not become unemployed after pursuing their course actually. Yeah.
Thank you, sir. Next question from Vishal Sarkar. What is the merit and demerit of distance course, diploma or certificate of population studies like IGNU?
Yeah. So I do not. Yeah. So I do not aware about whether IGNU offer a population studies degree or a certificate from IGNU, but IPS offer degree, master degree in population studies, and IPS population studies degree distance as well as regular have the same value. And I also believe that the UGC also gives same value of distance course both in IIPS, both is distance mode as well as in regular mode. So the also University of Anaimalai in Tamil Nadu, they also have degree in both distance and regular mode. So there is no difference in degree actually.
Okay. Thank you, sir. And last question is from Boshir Ali Karikor. How health geography and geographical information system are correlated with each other?
Could you please repeat again the question? Sorry.
How health geography and geographical information system are correlated with each other?
Yeah. So as I talk about this coronavirus. So suppose this this coronavirus is spread across the India. So across the India, but the number of cases in coronavirus is not same in every state. So the cases within states, the number of cases also differ. So like in India, the number of cases is highest in Maharashtra, in Kerala, in Karnataka. Within Maharashtra, the number of cases is very high in Pune and in Mumbai. So when we are talking about health geography, we are talking about spatial. We are talking about space. So these things is correlated with health geography. We in geography we study about space. So we are trying to understand why the number of coronavirus is higher in Mumbai and Pune and is low in Murshidabad or Malda district. So these things is linked with this health geography and this discipline of population or public health.
Okay, sir. We now I am going to give in a formal vote of thanks. So, Assalamu alaikum to all. I am Tanya Parveen. It is my privilege to propose vote of thanks on behalf of BES for this online career guidance lecture on career scope in public health and population studies. First, I would like to extend my sincere gratitude to Dr. Samarul Islam sir for his informative and insightful lecture. I must mention our deep sense of appreciations for sir for this such a nice presentation. I would like to thank the EC member of BES to arranging this online lecture. I want to extend my thanks to our lovely audience, their support and cooperation. Once again, I would like to state that we are glad to Dr. Samirul Islam sir here over the session. We thank you for being with us. It has remained a pronounced pleasure. Best wishes for all of you. Stay safe. Thank you so much, everyone, for joining with us. Thank you, sir.
Sir, one last question, sir. Can I ask?
Yeah, you can. You can.
Yeah, sir. Whenever I see the eligibility criteria in the Indian institutes related to public health, so they just mostly want children from the science background who have science in their 12th standard, and even if they show the course in the as the interdisciplinary part, then also they just somewhere prefer students from the science background. So what?